My name is Tanya Marumbwa. Sometimes I'm called Skara. I work for Zimbabwe People Who Use Drugs, INPUD. I'm a person who engages with government officials, health departments, and the community of stakeholders that can actually help us get harm reduction services implemented and going in Zimbabwe. I'm also someone who interacts with people who use and inject drugs at grassroots level, and I'm also a drug user, by the way. The one skill that I've learned is how to listen. And it's going to help me back in Zimbabwe when I go for those high-level meetings that can be very confusing sometimes, and I'll actually be able to listen out to when people are talking and sharing and giving out statistics about what's going on in other key and vulnerable population groups. I can also learn, listen and pick out what we are also supposed to contribute as people who use drugs, so that we can also be recognized and we are part of the health system and harm reduction services are started in Zimbabwe. Yeah, thank you.
My name is Kwame Juma. I'm the coordinator for the Tanzania Network for People Who Use Drugs, INPUD, which is from Tanzania, whereby our main role at the INPUD is advocating for the rights of the people who are using drugs, but also advocating for the policies changes, policies reforms to ensure that they conquer for the rights of the health services for the people who use drugs. But also we look for the engagement with other international networks and the regional networks, like the International Network for People Who Use Drugs, INPUD, and African Network for People Who Use Drugs, African PUD. And the main concern and the main objective is the same, advocating the scale-upping of harm reduction activities to ensure that people using drugs, injecting drugs in Tanzania and globally have the right for the health services and treatment and the other harm reduction packages services. On the training organized by INPUD here in South Africa, Cape Town, which took almost a week, I've gained a lot of skills with the concern of designing roadmap for advocacy programs and the international level, but also on the regional level and also on the grassroots level. Came to be aware of a lot of things, but the main things are the international declarations, of the political declaration and the concern of the people using drugs, health services, but also being able to look at the punitive laws and which are hindering the people using drugs to access the services. So with this training, ensure that I'll be able to go back to my country, Tanzania, and be able to look at the gaps on the whatever targets for scaling up the harm reduction activities in Tanzania, and advocating the programs to be implemented at all levels.
Okay, my name is Rita Musa. I work with Drug Harm Reduction Advocacy Network Nigeria as the National Secretary. I program for women who use drugs. I do a lot of advocacy with community members. We do human rights interventions for gender-based violence and all sorts of violations, human rights violations in our communities. One of the skills I've picked up from this 4 days training, it's been the one that stuck with me is the listening skills. I learned that it's necessary to listen to the people you're working with, the people you're advocating for, in order to do better when advocating for them. When programming, you have to know how to design advocacy that is tailored to address the particular issues of the people you're working with.